Welcome to HiNZ 2017. We're talking with Robyn Whittaker this afternoon, and Robyn gave a talk yesterday to the conference attendees on the Leapfrog program at Waitemata DHB. So Robyn, tell us about Leapfrog.
So Leapfrog is a program of projects basically. It's CEO sponsored program, so these projects are all given really high priority and visibility by our leadership, the CEO and the board, and they're all things that we think are really strategically important in providing benefits in the short to medium term, and particularly around DHB's main priorities, which are improving health outcomes and improving patient and whānau experience of the health system.
So what would be an example of some of the projects, Robyn, that you've looking after, or some examples?
Some examples. So in the first phase of Leapfrog, we picked up the electronic prescribing system, which had already been piloted, but we tried to fast track the implementation of electronic prescribing across our whole hospital. And we followed that with an electronic vital signs system, the patient track system. So now our nurses on the wards are mostly using an iPad mini, which they pick up at the beginning of their shift. And on that iPad mini, they've got the electronic prescribing app and the electronic vital signs app, and they basically use those two things quite a lot during their shift. They're entering their OBS into it, and they're entering their nursing assessments directly into it at the bedside, and they're also checking on the medications, getting alerts when medications are due or observations are due for particular patients, and they can carry that iPad mini with them. It actually fits in the pocket of a nurse's uniform, and so they can take that into the medications room, check they've got the right meds for the right patient, and then take it to the bedside again, check they've got the right patient, right medication, and enter in that they've actually administered the medication at the right time. So it's really become quite a tool for, a more digital and a more mobile way of working for our nurses in the wards. So that's a couple of examples.
So they really are sort of productivity and tools, quality tools for the clinicians. How do you go about involving the clinicians in the development or in the projects?
So that's really important. All the projects in the Leapfrog program really have to be supported by our senior management, by our heads of services, our clinical directors, and the GMs of the services. So it has to be solving a problem that they have and that they can really see the benefits of. And then most importantly, we have clinical leads on all of these projects. So we've brought together a Leapfrog team, which is people from all across the business basically, but including clinical leads for each project, as well as IT leads internally, and supported by project management and quality improvement type skills from our Institute for Innovation and Improvement. So those clinical leads, I think, has been one of the really important parts of this program. So these people, they're either still carrying on with their clinical job as well as leading a project, and some of them just seconded to just solely lead one of these projects for the time frame, maybe 18 months or so. And they are people who are really keen and passionate. They're often people who have quite an interest in IT, in particular if it's an IT implementation, like I've just given examples of. And so we train them up and we support them, and we help them to do this, but they're able to really talk to all of their colleagues in the service and really understand what the issue is that this implementation is trying to solve, or the project's trying to solve, and they can talk to them about how to try and fit this into their clinical practice, because they really understand what it's like to be on the floor. They understand how this is going to work and how it's not going to work. They can understand how things might need to be tweaked and adapted for different parts of the hospital. So we have that, every part of the hospital thinks it's special and wants something different. But having clinical leads, they're actually really able to talk to the service and say, actually, no, in this area, we think this is going to work for you. You're not that special. But in this area, yes, we can see that we're going to need to adapt this for you. We're going to need to give you a different mobile device, for example. So some areas have iPad minis, some have full iPads, some have computers on wheels. So they work with those services to work out how is the system going to work for you in your context? Do we need to make some tweaks to it, or are we going to try it first and see how we go?
So the very name Leapfrog for the program, that speaks to me. Is it a sort of a fast-tracking way that you've found to develop and implement the project? So
well, we try. That is the intention.
Is that the intention?
Is that we can try to fast track things. A lot of that comes back to that upper level support, visibility with the CEO. We report to him weekly, very concisely, and then he reports on to everyone else in the organisation and to Health Alliance, our shared service agency, about progress, with the idea that progress is maintained on a weekly basis, and if it's ever falling off, we have the red, amber, green status, and he's saying, okay, what can I do to try and help you get this back on track? What are the blocks? Where can we try and unblock things? We've done various things, like we've piggybacked on other developments around the country. We've piggybacked on others' procurement processes. We've piggybacked on other countries' development, international developments, where we've tried to see, okay, so how have others done this, and we've tried to learn a lot about the practical implementation from others before we start, so that we can try and fast track things. And as I've said, we've got this great team, and I think that they have been given the mandate through this program to actually problem solve, fix things on the run as much as we can, keep things moving. So they're real doers. It's a focus on doing and on solving the problems. So each time you do one of these projects, you lift up one stone and you find another 5 issues underneath that you've got to solve before you can keep going. And I think they are the kind of people who just get on and solve those 5 problems in whatever way that they can. So we've had things like small teams of people worked over the Christmas break to try and find a solution for ICU, who said, actually, this isn't working for us. We don't want to do this system anymore because we don't think it's working. So they got together our hospital engineering people. They went down to Bunnings and they bought new devices that they thought would work better for ICU. They made arms to fix them onto the ICU trolley. They did tweaks to the software to make it more appropriate for the ICU use. And then, within about 3 weeks over Christmas, they had something they put into ICU and said, okay, we've listened to you, let's give this a try, let's see if this will work for you. And they still didn't like it, but but they were very appreciative that people had really just come together and tried to solve the problem as quickly as they can, and look for other options, other ways to do it. And there's a lot of other examples like that, I think, that have made a big difference. So for example, we've got the electronic ward whiteboards. The team worked really hard to come up with a way to be able to print patient labels directly from the electronic ward whiteboard. That just makes nurses' lives so much easier, just to be able to do that rather than have to go and find labels, find that there aren't enough, get the ward clerk to reprint some. They're there on hand when they're actually doing these systems, using these systems. So little things like that, I think, make a big difference.
It certainly sounds like it. Yeah. Now, you mentioned a couple of phases in the Leapfrog program, and you're about to start on phase 2?
We have already started on phase 2. Yeah, we went back to the board and said, do you want us to keep going with this? And they said yes. So we have a list of things for phase 2 that we're working through at the moment, but some new projects have included My Patient List. So on top of our mobility strategy, we've developed our first app within our own systems on our mobile enterprise application platform. And My Patient List is being trialled at the moment, so it's an app for junior doctors, pharmacists, allied health within the hospital, so they can actually access the whole patient list on their mobile phone now, and they can filter that by ward or consultant or team to find the patients they're looking after, and then on the app they can actually view the early warning score, their observations, their medications, their laboratory results, most recent laboratory results, and they can write themselves task lists and indicate when they've done those tasks and so forth, and share tasks with other people. So it's really just an app to really try and help make their lives a little bit easier and get them away from having to write everything down on little scraps of paper, but to have everything on the end of their hand, basically. We're also doing a fantastic project with a new business intelligence tool called ClickSense that our analysts have been working on putting into practice, which is really going to make the data available to clinicians. So we're aiming big. We're going for the whole organisation, every service, having access to the data, the clinicians themselves being able to use this tool. and have dashboards with all of their main important indicators about how their service is doing, and then you can keep clicking through, click down to actually, right down to the patient level basically, to see what the problems are, where the blockages and so forth are. So we've got a lot of clinicians working on that project, and some of them are actually so excited by it they're doing the coding themselves to get the dashboards up and running for the different services. That's a great project.
So you've got quite a good cadre of champions.
Indeed.
And enthusiasts wanted to help you get it, get it going.
Yeah.
Now I can't resist, Robyn, giving a plug for the Telehealth Forum, because you're a member of the Telehealth Leadership Group, and you did mention that there's a telehealth component in the Leapfrog program, and what is that?
Really important. So we have for a little while been working in outpatients and trying to reduce the need for people to come back to hospital for follow-up appointments where they're not necessary. So we've been working with a lot of the services about how to have another look at their service, what sort of service they're providing for people in terms of follow-up. And one of the new ways of follow-up that we're really promoting at the moment is telehealth, is remote consultations from our specialists and our services in the hospital to people in their own homes. So we've been part of a regional RFP process around the technology for that, and we're just starting some trials at the moment with various services who are really keen to try and see how it goes, providing that kind of remote consultation for patients who either can't get back to hospital or find it really difficult, and who don't actually need to be seen in the sense of actually laying the hands on, but who are able to be seen over the video and have that sort of follow-up consultation in that way. So that's just getting underway at the moment.
And the focus is moving right out to the patients in the home, as opposed to hospital to an outlying clinic. It's directly into the home, which is a part of the leapfrogging of the providers. That's great. We'll be really keen to see how that one goes, Robyn. Thanks so much for sharing all of that with us.
Great. Thanks.
Thanks.